Man, I saw a plumber putting in a dishwasher. He got shocked. His hands tingling and hurting. He came in, I examined him. His exam was normal. I did an NCVT imaging study, it's normal. Electricity will enter one extremity and it exits through the spinal cord and out another extremity. If it's high voltage, you can be electrocuted and die. These kind of 110 injuries rarely are a problem, but we see it in plumbers or people putting in disposals, and they get standing in water while they're doing it, and they can get electrocuted. So there's generally no nerve damage, and this will get better. Most of these patients go away and I never see them again. There's some that have nerve pain we treat with anti-convulsants, like Lyrica, Neurontin, Trileptal, or any number of them. Their nerve conductions are normal, and there's no soft tissue issue. They're going to recover with time. So that's electric shock injury. We'll talk about electrocution injuries later. So Dr. Caudill Miller, the brain doctor. Like, comment, subscribe. More later.